Hello everybody, my name is Matthew Simone from Empire Surgical, and today I'm going to be speaking to you about shoulder anatomy. When speaking about shoulder anatomy, it is important to talk about the bones, the ligaments, and the tendons of the shoulder joint. Now there are three bones in the shoulder joint. These three bones are the clavicle, which is located on the superior side of the shoulder, the humerus, which is located on the lateral side of the shoulder, and the scapula, which is located on the posterior side of the shoulder. Now, it is important when you're talking about the bones of the shoulder to break down both the humerus and the scapula. Humerus can be broken into 5 parts. These 5 parts are the humeral head, the greater tuberosity, the lesser tuberosity, the bicipital groove, and the articular cartilage. Next, you got the scapula. The scapula can be broken into 4 parts. In these 4 parts, you got the scapular spine, the glenoid, the acromion, and the coracoid. Then we got the ligaments of the shoulder. The ligaments can be found in 2 spaces. The first space is called the subacromial space. The subacromial space is located sub, which means underneath the acromion, but it's going to be above the rotator cuff. So in that little space, you're going to see 3 things. Those 3 things are the acromioclavicular, the coraclavicular, and the coracomium. Now we're going to move down to the glenohumeral joint. That is where you're going to see the other 3 ligaments of the shoulder. Those 3 ligaments are the superior glenohumeral ligament, the middle glenohumeral ligament, and the inferior glenohumeral ligament. Now, since we're in the glenohumeral joint, I think that it's important to talk about the labrum. The labrum is a lip-like looking cartilage that circulates itself around the glenoid fossa and serves as a bumper to the ball and socket joint. To keep it in place, it provides both stability and concavity to the shoulder joint. Next is the tendons. Most of the tendons are located in the rotator cuff. The rotator cuff is an important part of the shoulder. A good way to remember the tendons of the shoulder, of the rotator cuff, is by a little acronym, SISIT. It's the word sit with a stutter. So you're going to have SISIT, 2 S's, IT. And the good thing about this acronym is that it puts the tendons of the rotator cuff from anterior to posterior. So you have the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. Now the reason I said that the rotator cuff is very important is because when you break down these tendons into their individual job, you'll see. You have the subscapularis, which is in charge of abduction and internal rotation. Then you have the supraspinatus. The supraspinatus as well is in charge of abduction. However, it differentiates itself by having external rotation. Then is the infraspinatus and the teres minor. They share the same duty. Limited role to just external rotation. Following that, you get the deltoid. The deltoid is a muscle in the rotator cuff that serves as a muscle in charge of adduction. Finally, last tendon, we have the bicep tendon. The bicep tendon attaches to the glenoid fossa at 12 o'clock on the labrum. It then runs itself through the bicipital groove and is kept on track by the transverse ligament. This has been Knee Anatomy with Matthew Simone. I want to thank you very much for your time. I'm looking forward to hearing your feedbacks, and I also want to thank you guys for your last feedbacks on my last speech. I hope you guys have a wonderful weekend. But before I sign off, I have to give kudos and props to Andreas for teaching me this little acronym, SISIT. Thank you very much, Andres. But guys, have a great weekend. I'm looking forward to seeing all of you next week at the meetings. Have a wonderful time, and we'll talk to you guys later.